Welcome to this complete explainer on pelvic floor physiotherapy during pregnancy and postpartum. I'm a senior pelvic floor physiotherapist at OVA Women's Health, and honestly, I am absolutely thrilled to guide you through this today. You know, pregnancy and the postpartum period are such beautifully remarkable stages of life. But let's be totally real for a second. They also bring some immense physical changes that can really throw a wrench in your everyday movement and comfort. So our goal today is to unpack exactly how evidence-based pelvic floor physiotherapy can support your changing body. We're going to look at how to prevent pain, speed up your recovery, and really empower you to move through this entire journey with absolute confidence. Let's get right into it. So tell me, did anyone actually warn you how different your body would feel right now? Because if you're currently dealing with things like pelvic pressure, bladder leakage, or just, general physical discomfort, I really want you to know that you are absolutely not alone. Honestly, nobody warned me my body would feel this different during pregnancy either. It can definitely catch you off guard, and sometimes it's a little overwhelming. But here is the single most important thing I want you to hear right out of the gate. You do not have to just suffer through it. There is so much that dedicated pelvic floor physiotherapy can do to help you feel like yourself again. Now, let's talk a bit about our core philosophy over at OVA Women's Health. We fundamentally believe that pregnancy is a completely natural process, right? It is not some medical problem to be managed, and your body is absolutely not broken. We really view physiotherapy as a way to actively prepare and support your body rather than trying to, fix something that's defective. So our specialized assessments look at the whole picture of your health, your posture, your breathing, your everyday movement patterns. We really act as your partner in this journey, making sure you feel completely cared for and proactive about your own well-being. Okay, let's dive into a major mindset shift here. For the longest time, the old way of thinking was basically that you just had to deal with pelvic pain until the baby arrived. You'd have well-meaning friends or family say, "Oh, that's just a normal part of pregnancy. You've just got to power through it." No way. The OVA way is completely different. We focus intensely on proactive support. We use targeted breathing techniques, modified movements, and hands-on therapy to actively relieve your symptoms right now. You absolutely do not have to wait until after delivery to start feeling better. Just to give you a bit of a roadmap for our explainer today, your pregnancy journey is essentially broken down into 3 distinct trimesters, and naturally, your physical needs are going to change in each one. In weeks 1 through 13, we lay the foundation. Then, in weeks 14 through 27, we manage those physical changes and help you grow comfortably. And finally, in weeks 28 through 40, we focus entirely on prepping your body for labor. It's important to remember that your treatment plan is always personalized and tweaked based on your specific trimester, your unique symptoms, and of course, your comfort level. So, starting with the first trimester. In those early weeks, as your body quietly begins to adjust, you might start noticing some subtle pelvic pressure, maybe a bit of low back pain, or even feeling like you need to pee all the time. We start things off with comprehensive postural support assessments to spot any muscle weaknesses or compensatory patterns early on. We also introduce diaphragmatic breathing techniques, which are a real game changer, by the way, to actively reduce tension in your core and pelvic floor. Plus, we'll give you gentle coordination exercises based entirely on your current activity level. It's really all about setting up those excellent habits right from the starting line. Now, a very common hurdle we see in this phase is a condition called Pubic Symphysis Dysfunction, or SPD for short. Basically, as your baby grows, your pelvic joints naturally relax and move to make room. And while that's totally natural, it can cause some pretty significant pain in the pelvic girdle. I know the medical name sounds a bit scary, but trust me, it is highly treatable. With tailored manual therapy and some very specific exercises, we can effectively relieve that pelvic and back pain, giving you real, tangible comfort as you go about your day. As we cross over into the second trimester, your baby's continued growth brings on some new physical challenges. We're talking things like sciatica, stress incontinence, or even constipation, caused by all those shifting hormones. So during this phase, our focus shifts to safely strengthening your core muscles. We want to robustly support that growing belly of yours without overloading your delicate pelvic floor tissues. We'll also deeply customize your pelvic floor exercises and give you practical lifestyle tips to keep your bladder and bowel health right on track. Okay, the home stretch. As you enter the third trimester, our focus shifts almost entirely to labor preparation. We want you going into delivery feeling incredibly empowered. We actually teach you perineal massage techniques, which surprisingly many women find really helps reduce their need for interventions later on to actively lower the risk of tearing. We'll also educate you on specific breathing and relaxation strategies for delivery and explore optimal birthing positions tailored specifically to your unique pelvic alignment. Because learning how to push effectively and consciously relax your pelvic floor can seriously reduce your anxiety and support a much smoother, more confident delivery.
And then, welcome to postpartum. Your body just did something truly, truly amazing. But now, it is time to gently heal. This transition can be a lot, right? Both physically and emotionally. If this sounds familiar, definitely bookmark this explainer and stay with me here, because postpartum recovery is a delicate process that deserves highly personalized, compassionate care. Whether you're dealing with perineal pain, urinary urgency, or abdominal separation, our physiotherapists at OVA Women's Health specialize in exactly this. We're here to support your early healing process without any judgment whatsoever. When it comes to your formal recovery timeline, most of our patients book their comprehensive postpartum assessment somewhere between 4 and 6 weeks. Here's how that works. First, we highly recommend you get medical clearance from your OB or midwife just to confirm your tissues are ready for rehab. Then, we meticulously assess your pelvic floor function and evaluate how any scars are healing. We'll check your abdominal muscle recovery. And finally, we map out a safe, progressive plan to get you back to your favorite fitness activities. The whole process is very structured, very warm, and completely focused on you.
During this time, you might hear the medical term diastasis recti. It sounds super intimidating, I know, but it is simply the natural structural separation of the abdominal muscles during pregnancy to make room for your growing baby. It is incredibly common, and because we take a whole body approach, we don't just look at the pelvic floor in a vacuum. We use progressive core stability exercises to carefully improve this abdominal separation and safely restore your overall core support and strength. Now, stay with me on this one, because this next part matters so much, especially if you are in the thick of those early postpartum weeks. We actually offer immediate relief for some very specific, painful challenges. We use gentle healing exercises and breathing techniques to quickly reduce swelling. But we also offer something pretty incredible: fast, effective relief for clogged milk ducts using therapeutic ultrasound. We even set aside emergency appointments for this to stop it from turning into mastitis, ensuring you can continue your feeding journey comfortably and safely. It's a lifesaver, for sure. Let's touch on something a little sensitive. Pain during intercourse after childbirth is a topic that so many women hesitate to discuss, but we absolutely need to talk about it. The medical term for this is dyspareunia. Postpartum, this pain can be caused by healing scar tissue, hormonal dryness, tight pelvic floor muscles, or even nerve sensitization. But the good news? Through gentle manual therapy and targeted relaxation techniques, we can effectively reduce that tension, improve blood flow, and fully support a comfortable return to intimacy. You do not have to just grit your teeth and live with this pain. Okay, if you take nothing else away from our time together today, please know this. There are certain signals your pelvis sends that you should absolutely never ignore. Please don't brush these aside. We're talking about persistent pelvic pain or vulvar pressure, any urinary leakage or urgency, ongoing constipation issues, or sharp groin and worsening back pain. Catching and treating these symptoms early is exactly what prevents long-term pelvic floor dysfunction. At OVA, we address the real concerns women face. Seriously, no symptom is ever dismissed or minimized. It all boils down to our core belief, which is simply this: you deserve to feel supported in your pregnancy and postpartum recovery, not just told your discomfort is normal. You deserve expert, compassionate support from professionals who have extensive international training in pregnancy-related pelvic care. So whether you are newly pregnant, actively prepping for labor, or navigating the complexities of postpartum healing, we're here to provide hands-on, evidence-informed treatment that consistently honors your dignity, your comfort, and your unique experience. So your next step is super simple. Just scan the QR code right here on your screen to easily book your comprehensive pelvic floor assessment at OVA Women's Health in Burnaby, BC. Remember, no referral is needed, and our specialized pelvic floor physiotherapy is covered under most extended health insurance plans. Space is limited due to high demand, so please don't put this off. The sooner we start, the sooner you can feel stronger and vastly more supported. So I'll leave you with this one question to think about. Will you continue to just power through the pain, or are you ready to finally reclaim your body and step into lasting pelvic health today?